He's talking about must.
Yeah.
Thank you.
Good morning, everyone. So respect and revered teachers on dais and off dais. I'm very happy to kick things off. First day, first talk. So the talk is on teaching in a busy OPD. Is it an optional one or is it a must? So I'm going for must. We have to teach in a busy OPD no matter what. That is going to be my talk. So I'm a medical officer from Aravande Hospital, Coimbatore, and most of you might know that Aravande Hospital receives a lot of patients. It's a high volume institute. So I think I'm in a better place to justify the fact that we should teach a resident in a busy OPD. So I'm going to put forward 3 questions. Why should we teach? When should we teach? And how? So first let me start things with why. 3 reasons why we should teach a resident in a busy OPD. First and foremost is empowerment. We are going to educate a resident, be it in the OPD or outside the OPD in the classroom setting. When we educate, we empower him or her, we convert him into a competent and confident consultant. When he becomes a confident person, then I can delegate my work to him. Thereby, it will reduce my workload as well when he starts seeing patients. So it's an investment on my part to train him. Third and foremost, betterment. Not just residents get better, even I become better. As teachers, we learn the most when we teach others. So for the consultants, when they teach residents, the common endpoint is effective learning. Now let's talk about the actual practice. When should we teach? I've divided into 3 aspects: before, during, and after the OPD. Before and after the OPD are the gold mines. They are the most underutilized areas when it comes to teaching. But our concern is going to be during the OPD. This is the basic patient flow. When patient 1 goes to the visual assessment and refraction, he meets the resident number 1 at the prelim station. The resident is going to take the patient, he's going to examine the patient, ask meticulous history, and he's going to bring the patient to me, that is the MO at the final station. So there's a first scope for teaching. I will see the patient and I will correct his findings. Scope 1. When the patient 2 all by himself comes to me, I will examine the patient, and if there's any interesting finding out there, I will show and tell the resident about the findings. The second scope is show and tell. When the patient requires a specialty care, then I'll ask the resident to escort that patient to the specialty center, for example, a cornea or retina. So that is the third scope for teaching: show, tag, and teach. So we have 3 scopes for teaching in a busy OPD: see and correct, show and tell. The third is tag and teach. If we can follow any one of these 3, then we have achieved effective teaching in a busy OPD. It is possible. The last question is how? Our teaching has to be precise. It has to be clinically relevant, crisp, and concise. To deliver that kind of a crisp teaching, we have to be competent enough to know the points. This is one take-home message I want to give you guys today. It's about the quality of teaching. Now, I developed a feedback form where I can give my residents to assess on how they learn and how well I teach. So 2 parameters are being assessed. This is the basic feedback form. This is a rough sketch what I gave to my residents when I mentored them in my busy OPD. So as you can see, it has 2 parameters assessing both my teaching as well as their learning. This is the feedback form I gave to my resident actually. And you can see this resident has told that teaching in an OPD practice has proved to be more productive for him or her. And he tends to sleep in the classroom basically. So it's a honest admit from the resident here. And we all know that learning bedside or learning from the slit lamp side is the most effective form of learning. But at the end of the day, it all boils down to this: stronger the roots, tastier the fruits. If we are going to invest our time and energy in training the residents, we create capable and competent consultants, which eventually will lead to a better patient care. So thank you so much. And this is where I take my classes online. This page has more tips and tricks on teaching residents and ophthalmology in general. So thanks a lot.